UTI, it is in an abbreviated form, but in details, it is urinary tract infection. These are the infections that affects the urinary system, majorly or the reproductive system in women in most cases. Urinary tract infections, these are infections which are categorized according to the causative organs or even on the way how they spread. One, we have what we call fungal infection or bacterial infections when they are UTIs. Bacterial infections, they're a bit different from fungal infections because now if you go into a laboratory test, that's when they will give you an explanation. We have, like when they do the test for a UTI, the recommended ones, we have urinalysis, we have sensitivity and culture, and then we have also, at times you can use scan. By scan, we look into the internal organs, how they are concentrated, or even how how the reactions of the infections to the, for example, in the kidney and also in the bladder or in the fallopian tubes, whereby we detect the fluids that are there inside. But if you look at the causative organs, as I've told you, that we have bacterial infections and the fungal infections, but those are the causative organs. But now we have UTI or the urinary tract infections. They are just there, but we have different types of urinary tract infections. For example, we have candidiasis, which is a fungal infection. We have trichomonias vaginalis. We have chancre, we have chancroid, we have genital warts, and others. So, if you look at all those types of UTIs, they differ and they have different signs and symptoms. However much some other people who keep on misguiding people, they keep on giving this clear, unclear explanation due to symptoms and what. And also we have to know that some infections, they are more, or they affect one kind of a species. For example, if they affect women, it is very hard to see them in male. And when a man gets them, it is very hard. Now, like, it is very, very hard for a man to contract candidiasis unless when it is oral candidiasis. Oral candidiasis is when a person, instead of doing real sex, but goes in for oral sex. That's when they tend to get oral candidiasis. And I've told you that it is a fungal infection. So in most cases, those infections, they present with some symptoms. We have what we call lower abdominal pain, the pain that is under the abdomen or in the waist. And one of the complaints that ladies normally give, we have what we call back pain. Back pain, it is normally at the lower part of the waist, at normally the region of L6 and L8, at the lumbar region. So they normally experience that kind of pain. We have what we call, to ladies, we have what we call vaginal discharge. So the vaginal discharge will differ according to the infection. We have what we call the milky one, which is whitish in color. We have the one which is greenish, it is there. And also we have the one which is yellowish. Also it will depend on the kind of the infection we are having. We have also another symptom of painful maturation. Painful maturation is when you're having pain while urinating. It is both in men that have contracted some STIs or those UTIs. We have gonorrhea. After having sex with your female partner, you get those infections and then it turns into gonorrhea. You might also develop some pus. And then when you're urinating, you get a problem. You feel that passing out urine, it is hard or it is what. So that is a symptom. And also we have what we call hematuria, urinating blood. Some people, it is an extent that when the infections affect the urinary system, like the urinary system, we have what we call the kidney, the urethra, the gallbladder, the urethra, and other type. So they might be affected and a person end up urinating blood. So the same infection also, we have another symptom whereby you fail to urinate. Like you try to pass out urine when you cannot have what? Urine. Also, we have what we call frequent maturation. When you're urinating every time you cannot, you feel like every time you take something, every after 2 to 3, 5 to 6 minutes, you want to go and do urination. So that one is also a symptom. And also we have pain inside the bladder, pain at these sides of the kidney sides, on both sides also. And when it is also severe, we can have some fever. Some fever is nowadays it is present with some fever, some body weaknesses, some dizzinesses also. Those are some of the symptoms of the UTI.